Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Access to healthcare is hindered by many factors, some of which include lack of medicines in health facilities, absenteeism of health workers, among others. However, apart from such institutional challenges, culture and deeply held beliefs can also adversely affect people's attitude towards seeking health care. Teddy Nalubega and her 15-year-old niece are here at Kosu Hospital in Chisubi for a medical review because the teenager's left leg is very painful and it is dripping with pus. But all this started in 2015 when Teddy's niece was diagnosed here and found to have osteomyelitis, which is called etalo in Nalubega's mother tongue, Luganda.
Kati nagenda okulaba ng'okugulu kujja nnyo amasira ne mujja 2016 ne mbeerako naye ebbanga nkyanoonya ku ssente ne muleeta wano ku Koso.
Teddy defied the mythical tendencies attached to this illness and asked her niece's parents to have her taken to hospital.
Era nagenda obbagamba nti tugende mu ddwaliro nga babeera awo bya Kiganda kusiiga kola ki yalinawo kenkyukakyuka kuba kwasooka ne kusirikamu naye ne wasigala wakawuntu katini nnyo ke kagenda nga yongeramu kwe kati nga kafulumya.
Dr. Peter Mukisa says the disease is caused by a bacterial infection in the bones.
Sometimes it could come as a result of an injury that also traumatizes the bone, and then you get the infection moving from there outward. So it starts first of all in the bone and then starts moving out towards the skin and the other soft tissues. Most commonly, children with respiratory infections usually tend to get osteomyelitis secondary to the blood spread.
Dr. Mukisa says the bone infection can be as a result of bone surgery like knee and hip replacements.
Sometimes it may come from an infection that was originally there. For example, someone was infected through the throat, yes, through a chest infection, and then the bacteria travels through the blood to the specific site of the infection we are seeing currently. Sometimes it can be from maybe you had a wound somewhere and then it continues to dig further and then you get the infection there. Sometimes if there is trauma to the bone, for example, if you suffered a fracture, sometimes if it's not properly managed, the bacteria from outside or even from the skin itself may move to that point of the bone, and then you get a resultant osteomyelitis.
The disease is symptomized by pain, especially in the affected part.
It usually affects the long bones of the body, in the lower limbs and then in the upper limbs. Although it's been known to affect the mandibles, the jaws, and other smaller bones. As it progresses, you're going to see a small hole, it's called a sinus, that starts to produce pus. If also not managed, it can end up into a large wound that's very hard to treat. You find that a patient will present to you with this swelling and the pain, and then continuous pus discharge. They say they've tried to treat it severally, but the pus just keeps coming out.
However, this disease is not so prevalent. Globally, only 2 people out of every 10,000 people get osteomyelitis.
The trends are still the same, but more cases are being identified, because what has also helped this disease, if I can say, to progress, is the fact that, one, people stay at home with it.
This condition affects both children and adults.
In its early stages, it can be managed quite well successfully, yes, but if not managed, it can lead to limb loss, it can cause sepsis, patients can go into shock from the infection and can also lead to loss of life, but that's at the very worst.
Treatment is both surgical and non-surgical depending on the state of the patient.
What will help us with the diagnosis is the clinical picture first of all. It's what helps us in most of the cases. Then we can also do some imaging, although in the early phases the X-ray won't show very evident osteomyelitis in the very early cases. Yes. But as you go on, the X-ray will start to show you features of the osteomyelitis. for treatment in the early phases, patients benefit from antibiotics, broad-spectrum antibiotics. Yes, but usually if it's gone on to the chronic phase, then usually the most appropriate way is to manage them surgically. You cut and then you sort of remove the pus where the pus is coming from. We can start with the decompression. We remove the pus and then the patient gets relief. However, we may also have to intervene further by removing the infected bone. Yes. Sometimes if there is a defect left behind by the part we've removed, we may have to replace it with a bone graft, or sometimes if the defect is not so much, then we just leave the new bone, and the new bone will start to heal over the old area.
Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.